Chapter 10, Finishing and Polishing Aesthetic Restorative Materials. Finishing and polishing directly affect the aesthetic qualities of color and gloss for any tooth-colored restoration. This chapter of Finishing and Polishing Aesthetic Restorative Materials describes the benefits, objectives, and the various types of hand and rotary instruments for finishing and polishing composite, ceramic, and natural tooth structure. Also, it emphasizes the importance of utilizing proper finishing devices, polishing techniques, and protective surface glazes at the maintenance visit to enhance the longevity of the restoration. The clinical techniques section incorporates the consideration factors for finishing and polishing both composite and ceramic restorations, which include the instrument shape, the surface shape and the texture of the tooth in the restoration, the surfaces of the finishing and polishing instruments, and the exact sequence of the restorative treatment. This chapter illustrates the clinical procedures for finishing and polishing tooth-colored restorations with each of these considerations in mind, with photographic precision of the instrumentation at the exact angle it should be utilized. Chapter 11, Dental Photography. Since I was 4, I have been a photographer, and this chapter is my life. It begins with a historical perspective of photography, while providing a thorough description of the digital camera, its function, and the clinical applications for digital photography. An evaluation of the basic components of the camera system is provided, so the reader will have the necessary objective information for selection and subsequent application of a 35mm system for clinical photography. Subjects such as reflective exposure metering, exposure compensation, exposure modes, and incident exposure metering are explained through written and photographic illustration. Also, I provide a guideline for the selection and application of digital camera systems. In the clinical photographic techniques section, I share with you my 16-image photographic series, which describes the magnification ratio, patient orientation, photographic composition, position of the camera angle, and flash position for each of these intraoral and extraoral views. And you can see how I do it from an aerial perspective. This can train you and your staff to not only understand how, but why. Chapter 12, Periodontal Plastic Surgery. This chapter integrates surgical periodontal plastic surgery procedures with contemporary restorative therapy. It describes the clinical rationale, indications, and the various surgical methods for clinical crown lengthening, subepithelial connective tissue grafting for root coverage, and hard and soft tissue ridge augmentation. Tables are provided for specific classification of crown lengthening, recession-type defects, and ridge deformities. The clinical techniques section not only provide a detailed photographic and written description of the surgical indications and methods, but also provide the rationale and sequence for integrating these procedures with restorative therapy. Complex aesthetic and restorative challenges are sequentially treated using an interdisciplinary approach from the initial diagnosis through treatment planning, surgical intervention, provisionalization, laboratory fabrication, to the final result. Chapter 13, Interdisciplinary Implantology. This chapter describes the current implant biointegration concepts through the philosophy and principles of restorative-driven implant placement. Just as the initial illustration by Nicholas Elian emphasizes, let the restoration be the guide. It emphasizes the importance of communication and management of the patient through an interdisciplinary pre-surgical strategy. This chapter describes the diagnostic and treatment considerations and communication tools for achieving precise and predictable peri-implant aesthetics. It reviews the biological parameters that should be considered for precise implant placement and describes the current interdisciplinary surgical treatment strategies available. The clinical techniques section provides a detailed photographic and written description of the surgical procedures that can provide preservation, augmentation, and biointegration of the peri-implant architecture. The various clinical scenarios provide a complete overview of the different surgical and restorative treatment procedures that are available for single and multiple implant placement. While each illustrated clinical situation provides the specific biomaterials, instruments, and techniques required to achieve predictable and consistent solutions to aesthetic challenges. Chapter 14, Biomodification of Tooth Discoloration. This chapter describes the extrinsic and intrinsic etiology of tooth discoloration. Teeth can be discolored for many reasons, and the factors responsible for these stains determine the color, anatomic location, severity, and the selected treatment. This chapter emphasizes that cosmetic treatment considerations should begin with the most conservative procedures and progress as needed to more invasive alternatives depending upon the depth of the staining. Conservative cosmetic treatments for tooth discoloration are reviewed, including transitory methods for bleaching vital teeth and non-vital bleaching techniques for the treatment of discolored endodontic teeth. Also, more permanent chemical elimination procedures are reviewed, such as macro and micro mechanical abrasive treatments for the elimination of superficial enamel discolorations. The clinical techniques section provides a detailed photographic and written description for fabricating precise fitting bleaching trays, the materials and instruments used for their fabrication, and the critical criteria for application by the patient. Various clinical procedures are used to illustrate vital and non-vital bleaching techniques, emphasizing the importance of comparative photography for review and documentation. A detailed photographic and written description of enamel macroabrasion and microabrasion procedures are illustrated and even combined with composite bonding procedures where the enamel discoloration is too deep. Also, with a description of each biomodification of tooth discoloration procedure, is provided the biomaterials, instrumentation, and even the specific criteria required to achieve an optimal aesthetic result. Currently, there are a number of publications that describe the relative physical and mechanical properties of the various restorative materials used by the clinician. Some information also is available about their relative clinical behavior. This publication is different and unique from others in that it is based upon the concept that optimum clinical results are best obtained through the proper utilization of a material rather than on the physical differences between them. The use of each material and technique covered in this text is depicted in over 2,000 detailed high-quality photographs. Furthermore, a material science background is presented for each of the materials addressed clinically. This text, Aesthetic and Restorative Dentistry, Material Selection and Technique, can provide each member of your staff and team one or more of the following. It can provide the clinician and technician a thorough understanding of restorative and surgical principles and procedures. It can improve the auxiliary staff's understanding of a myriad of procedures, from pouring a model to taking a shade with photography to understanding the significance of perioplastic surgery procedures. It can also promote an interdisciplinary thinking process while directing uniformity in the restorative team. And it can stimulate an internal marketing process by providing the patient with current restorative options for a proper informed consent. I hope you and your team enjoy these words and photographs as much as I enjoyed creating them. I hope you and your team enjoy these words and photographs as much as I enjoyed creating them. But remember, they're only words on paper until you bring them alive with your imagination.